Good morning, everyone, and thank you for joining me today. My name is Tyson Thomas, and I am one of the reporting scientists at Cansford Laboratories. Today, I will be talking to you about alcohol testing and helping you to understand the options that are available to you. So first off, let me talk to you a little about our laboratory. So Cansford Labs can trace its roots back to 1993, where John Wick and Lolita Sinaklis developed the UK's first hair testing regime for drug and alcohol use, thereby providing over 30 years of experience within the hair testing industry. Since then, our methods have been copied and used by laboratories across the globe. We pride ourselves on fast, accurate testing, offering a wide range of testing services for individuals and organisations, focusing on delivery, quality, and upholding our record as the UK's fastest drug and alcohol testing laboratory. We have collectors across the country who will collect samples from clients and send them to our modern laboratory in Cardiff. Following consumption. So, why does alcohol testing matter? Following consumption, alcohol is cleared from the body fairly quickly. Therefore, if someone drinks tonight, it may be undetectable in their breath by the morning. So depending on the amount of alcohol or ethanol consumed, breathalyzers can detect alcohol for up to 24 hours after consumption. But such methods will only capture a record of recent alcohol consumption. However, when a history of drinking or abstinence over a longer time period is required, such as directed by a court, then specialized biomarker testing becomes essential. Has someone been drinking heavily over the weeks or months, or has someone's abstinence been maintained? The testing performed at Cansford Laboratories can aid you in answering these questions. So at Cansford, we offer a complete range of alcohol marker testing across a range of different sample types. In hair, there are two alcohol markers we test for: ethylglucuronide, or EtG for short, and ethyl palmitate, or EtPa. Both of these are direct biomarkers of alcohol consumption. They can be produced and therefore detected if an individual has consumed enough alcohol to be absorbed into the hair. We also test for EtG in nail. Whilst head hair can be segmented, nail cannot. We also test for PEth in dry blood, and this is a direct alcohol marker that can indicate a pattern of alcohol use within the approximate month prior to sample collection. In the same sample, we can also test for EtG in the blood, which covers a much shorter time period of up to 2 to 3 days from the date of collection. We also offer venous blood testing for carbohydrate deficient transferrin test, or CDT, a liver function test, LFT, or a full blood count test. Each method has its strengths, and together they can provide a full picture. So, starting off with our dry blood spot tests. Cansford Laboratories offers both PEth and EtG testing in dry blood spot format via a finger prick. PEth testing detects alcohol use over the approximate month prior to sample collection with unmatched sensitivity. What makes PEth particularly valuable is its specificity. PEth is formed in the presence of ethanol and accumulates in the red blood cells. What this means is that PEth is a direct alcohol marker and therefore a valuable tool to detect alcohol consumption. So there's no confusion whether environmental exposure or other factors have occurred. So with PEth, we can look for abstinence or low alcohol consumption. We can look for excessive alcohol consumption, or we can look for in between of just, are they drinking alcohol? We can also look at the EtG in blood, which reveals intake of alcohol within the last 2 to 3 days, even from 45 minutes from the date of collection, from the moment of collection. As a direct metabolite that only forms when the body processes alcohol, the detection of EtG in blood provides a clear evidence of recent consumption. The EtG test can help support or refute a donor's claim of abstinence, as a positive EtG result confirms alcohol has entered the donor's body within those 2 to 3 days prior to collection, whereas a negative test could help support the claim of abstinence from alcohol consumption. The blood EtG test is a complementary test that's included with all our PEth tests, giving you that crucial short-term detection window that is particularly useful when needed to investigate recent instances or concerns. So the collection for dried blood spot is simple and it's minimally invasive. A small drop of blood is collected into a capillary, transferred onto a paper and then allowed to dry on the paper. This creates a stable sample that can be stored and transported easily, unlike a venous blood sample test in a test tube. The advantages of this is that it is minimally invasive and suitable for those who have needle phobia or poor venous access. Samples are also easily stored and remain stable in varying conditions for quite some time. Also, as said earlier, we offer dual testing with the same blood sample, so you can get both PEth and EtG from a single collection, this saving you both cost and time. So, hair strand testing. EtG and EtPa are alcohol markers found in hair following alcohol consumption. They can stay in the hair as it grows, allowing us to look back over months, typically up to 6 months with a head hair sample. Both markers are highly sensitive and can identify heavy chronic consumption, although EtG is particularly useful if you're looking to detect abstinence or regular consumption. Certain hair chemical treatments can affect alcohol markers differently. EtG levels in hair can be altered by the use of chemical treatments such as bleaching or dyeing or colouring or even perming the hair, which can reduce the concentrations detectable. EtPa, on the other hand, whilst it can be reduced, it is more resilient against these. However, EtPa has been shown to have been elevated by the use of certain hair products. But using both these markers together gives a broader insight into drinking patterns. One of our unique offerings here at Cansford Laboratories is our sectional analysis of alcohol markers. What this means is we can break down the hair sample into smaller segmented sections, allowing us to examine a person's pattern of drinking over different points of time, and to see if there's been any changes in their drinking habits. So if you're wanting to test if you're wanting to look at 6 months of a person's drinking, and your client says that within those 6 months they've cut back, they've cut down, or even become abstinent recently, whilst a normal overview test cannot show this, it'll just show an integrated result of the time period. Segmented hair testing could aid in supporting your client's declaration by looking at the patterns of each section. So this is just an example of showing what I mean. So if you do an overview analysis, it offers a broader picture of, say, for example, 3 months, and it is an integrated average. Whilst if we section those, it breaks them down into smaller segments, for example, 1 month each, which can offer a clear, more specific understanding of a usage pattern within that time. This, however, is only for head hair. If we are required to test body hair for alcohol, this is only analysed at full length and cannot be segmented. So to perform sectional analysis, we would need to do it on a scalp hair sample. So the hair strand collection. The collection process for hair is straightforward and non-invasive. when compared to other forms of matrices, such as blood and urine. A trained collector takes a small sample from the crown of the head, and if head hair is not available, then body hair is available and can be collected. The samples are then securely packaged in tamper-evident packs. They are signed by your client, showing that they have witnessed the collection, they've witnessed it being sealed, and the sample is theirs, and then it's sent to our laboratory. Hair testing offers advantages over other forms of testing. An example of this is the longer detection window. Whilst venous blood, urine, and saliva cover shorter time windows, and they have their benefits for doing so, hair testing covers a much longer time. And with testing alcohol in hair, it could be up to 6 months, depending on the length of the sample. It is non-invasive and it is quick to collect. Also, samples are easier to store and easy to transport. But when there's no head hair and when there's no body hair, your client has shaved everything off, or they just refuse to stop bleaching their hair, nail testing is an alternative that we offer. We test nails for EtG, so we clip the white part of the nail and we package it similar to how we package the head hair, in the same envelopes with the evident tamper seal, and then we send it to our laboratory. Nail testing provides a broader overview of alcohol consumption over time, with fingernails covering up to 6 months and toenails covering up to 12. However, similar to body hair, it is not possible for us to segment nail samples. Venous blood tests also offer additional insights. So one of the most commonly requested venous blood tests that we offer is a CDT test. This detects heavy alcohol intake over the past 2 to 4 weeks. However, CDT can be influenced by many other factors, such as liver disease, genetics, or medical conditions, or any other medications being taken. So results must be interpreted with caution when it comes to CDT. Liver function tests measure enzymes and proteins to assess liver health. This is a snapshot of the health of the liver at the time of collection. While they don't directly measure alcohol intake, they can indicate stress or damage related to prolonged drinking. However, together, these tests can provide supporting evidence of sustained alcohol use. So at Cansford, we interpret the results alongside any declaration of alcohol consumption by your client. This allows us to identify patterns of consumption over time, rather than relying on a single measurement. Many biomarkers have measurable half-lives, meaning past heavy drinking can still reflect even after abstinence begins. So by monitoring changes across repeated tests, these trends can provide a clearer and more meaningful picture of consumption patterns rather than through a single test. This is just a context of the interpretation. So when choosing a laboratory, accreditation is key. We are accredited at Cansford Labs to an ISO 17025 standard, and we hold Lab 51 accreditation certification, which means our methods are validated, our equipments are calibrated, and our results are quality controlled. Because we process hair and dry blood spot samples in-house, we maintain complete control of quality and deliver industry-leading turnaround times, which is just 3 days from sample receipt at the laboratory. So to summarize everything we've gone through, alcohol testing is complex, but specialist biomarker testing provides a reliable insight into patterns of use. There are different methods that we can use to test for these, such as hair, nail, dry blood spots, or venous blood, each offering its own unique advantages and strengths, and together can provide a clearer picture of consumption for your client. And in interpreting results in context is essential for meaningful conclusions. At Cansford, we combine scientific rigor with practical collection methods to deliver fast, accurate, and clear results. So I'd like to thank you for your attention today for this webinar. Now, I'm happy to take any questions at this point. So the first question we got is, would you say PEth is a go-to option or is hair preferable? That really depends on what you're looking for. So if you're looking at testing someone's historic consumption, hair is definitely the go-to. So PEth is only, if you start testing PEth, you're looking at the most recent month that's passed. And then if you're looking at patterns, doing monthly PEth testing can be beneficial. Now, if you're looking at historic consumption, that's where hair testing comes in. They can both complement each other. So I had a case not long ago where a person, he had admitted to consuming chronically until 3 months before the test. He had tested a 3 month centimeter of head hair, which still turned up chronic, but alongside PEth testing, which was negative, it showed that he was abstinent within the most recent month. And with subsequent tests, as his hair sample was reducing, his PEth test was showing negative. You were able to see that he was consuming, well, he was abstinent, and his hair was just taking a little longer for it to leave. Both offer their advantages. Neither preferable over the other. It just depends on what you're looking for. What about bald crown of the head? How does a sample from other part of the scalps compare? Well, that's something I also suffer from. And we try and collect as close to the scalp as possible. But if you collect from other parts of the hair, one of the biggest differences comes down to the resting phase of the hair. So closer to the scalp, closer to the crown, it's the most uniform. Most literature states that 85% of the hair is growing and 15% is resting. The further from the crown you go, the more resting phase hair there is, which could mean it could take longer for a result to show a negative result if they're trying to prove abstinence, similar to the case I had earlier. Otherwise, there's not really much difference between them. Is segmented head hair testing relatively new? We have always understood that alcohol testing could only be an overview. Now, it's not relatively new. We've been doing alcohol testing for we've been doing segmented testing for alcohol for quite some time. And it's only really now being adapted onto the market. Some labs do say that the practice of segmentation of hair samples to analyze blood is against the Society of Hair Testing, but the Society of Hair Testing does state that it can be useful to provide additional analysis. It is still in the guidelines about this. So it can be particularly beneficial where someone has drastically decreased over the time. So this is something that we at Cansford were looking at. We've published papers, we've published posters, we presented evidence, we presented this at conferences, and we feel confident to supply segmented alcohol testing to you. We've been doing it over many years, and I feel confident in the interpretations that we offer and the patterns we've seen. We have found there's been very useful, especially when a person's pattern has changed within the time period covered. So it's not that new, but it is starting to get a big build up on the market. What about minoxidil for hair growth? Does that affect testing at all? So minoxidil, the one thing I know about this is that it does contain it depends on what you take. So some minoxidil is pill form and some is a cream. Minoxidil does contain ethanol. So this can affect the ethyl palmitate result. I don't know if all of them do, but the some I've seen have, especially with Just for Men. This can affect the EtPa result. However, the EtG result is produced by the liver upon the presence of ethanol. So we wouldn't expect a hair product that contains ethanol to have any effect on the EtG. So it's for this reason that most laboratories base their overall interpretation on the EtG result. Is there any crossover when also questions are coming in faster? They're covering the old questions. Let me have a look. Is there any crossover when also identifying drug use, or are biomarkers completely different? From what I'm getting from that is that alcohol biomarkers are different tests to drugs. So if you just test someone for alcohol, we won't be able to use it to identify any drug use. That is just looking at whether ethanol is present in the hair, and these two biomarkers are metabolites of ethanol. So if these two are present, it means that ethanol is present. EtG, if it's present, it means that ethanol has been metabolized by the liver. And ethyl palmitate present, as I said, can mean it's been metabolized by the liver through consumption, or hair products can affect it. But it will not, there's no crossover with drugs. It will have no relevance towards any drug testing. What would be the longest alcohol could stay in the hair strand? So with head hair, we test up to 6 months. But it does take, as hair is resting, it can take some time, but it's usually only with recent consumption we would expect for someone to still show result. We have a common misconception that when people have consumed alcohol, especially at an excessive level, for several years, and then 3 months before the test, they quit drinking. So they then test a 0 to 3 sample and expect it to be negative. This isn't always the case, and it can take some time in head hair for it to leave. But not I've seen it leave quite in a few months. It's only in some rare cases that I've seen it last a little longer, and that's where PEth testing can help with this, and it can help aid the interpretation. Whereas the case I said, he was still showing results, even though later on they weren't chronic and they were dropping every month quite drastically. His PEth testing was showing negative, showing that he was abstaining, and it was just taking a little longer for it to leave the hair. Can you distinguish between alcohol consumption in a drink sense and alcohol from other sources? So EtG is produced by the liver on presence of ethanol. So what that means is that ethanol has entered the body and has been, and at a significant level for it to be processed by the liver to then be in the head hair. Usually that is an indication that someone has consumed alcohol, but we cannot determine how the ethanol has entered the system. But with EtG, it's more likely from drinking. With EtPa, as I said, it can be elevated from the use of hair products. So if we're looking at a negative EtG and a positive EtPa, and they're using hair products, it's more likely that the EtPa present is from the use of hair products if they contain ethanol. Does hair color impact results for alcohol? Not from my understanding. There is evidence that has shown that hair color has had an impact in drug testing, specifically around cocaine, where people with darker hair with higher melanin it's shown that cocaine has an affinity towards higher melanin and lower melanin. So people who use cocaine may show a higher result for cocaine with darker hair than those with lighter hair. But I've not heard of anything that this can have an effect with alcohol testing, as this is something that's processed by the liver. Does coloring hair, for example, bleach, affect testing? If so, would you recommend testing body hair or nails? So coloring the hair can affect testing. Alcohol testing, drug testing, anything that damages the hair can reduce the concentrations of anything that's in the hair. So coloring the hair, such as dyeing it, can have an effect on the EtG testing. EtPa is a little more resilient, but it can still have an effect. Now, bleaching, regardless of the resilience of EtPa, it will still affect it. But because a hair has been bleached and dyed doesn't mean it's not there. So we can still test a hair sample if it's been bleached and dyed, and results may still show up. It's just that they have been reduced due to the use of this treatment. Would we recommend body hair and nail? Well, it depends what you're looking for. So if you're just testing to see if they're drinking chronically, and it's and you don't mind that it covers a little longer, then yes, we would recommend going for these samples, because whilst it has happened, people are less likely to dye their chest hair or dye the body hair samples, and same with nail. But they can still have these effects where someone can bleach their nail to damage it, or someone can decide to dye their body hair. But yes, this can be done. If you're starting to look at smaller time periods or smaller segments, and you're only looking at a specific time period, so you know that they were chronically drinking before, but you want to see the most recent 2 or 3 months, then you may not be able to get that with body hair and a nail sample, as that's an average, and it could still show chronic drinking over that period. So yes, if someone's bleaching and dyeing their hair, and you just want to see what their consumption's like, and not really more towards a specific time period, then nail testing and bleaching is definitely the way to go. High PEth relates to over 4 units per day. Your guidance says, client drinks says 2 glasses of wine a day. She had a high result. Can that help quantify much higher intake? Unfortunately, from a result, we can't quantify to an amount drinking. We can't say from a concentration of PEth how much a person is drinking, or even if they drank every day. There's too many factors in place on why the PEth is high. If your client has got a PEth result and it is at that level, and they're curious on, and they come up with our consumption and say, could it be to this? I'd recommend emailing the laboratory with the question, and and if it's us, we can answer it in time for that. But we're not able to quantify a result to a level of alcohol consumed. It's not something that can be done. Does the sample collector ask about hair products, or is it that the person requesting the test to ask? Our sample collectors are trained to ask about hair products. The issue we mostly have is whether the person is more willing to share those hair products, and I understand, I appreciate it is a stressful situation, whether they can think of those hair products at the time. So if they ever remember any hair products after the collection, or wish to share this information with us, they can email us about it later on, or they can pose it in some questions when the results come through. But our collectors are trained to ask about the use of any hair dyes, hair treatments, and hair products. How can emerging synthetic drugs that constantly change their chemical structure be reliably detected without relying on substance-specific assays? Well, this webinar is to do with alcohol, so I wasn't expecting drug testing. But if there's anything you ever need to test for, just email us and we can have a look if it's something that can be done in a laboratory. We understand that with synthetic drugs, and it's the one reason why the government brought out the act in, I think, 2016, that made a blanket ban, is because synthetic drugs are changing all the time. It is difficult to keep on top of them. But send us an email asking about this drug, and we can see if it's something we do test for, or if it's something that we can look into testing for. Is nail testing affected by beauty treatments? Nail testing can be affected by anything that damages it. So if a person is constantly putting acrylic gels on their nails, and then using acetone and other products to remove it, it can damage the nail, and it can have an impact on the nail result. A person can choose to bleach the nail. Nail isn't impervious to being damaged and therefore affected by this. It's just something that's less likely to happen if a person keeps bleaching their hair. This is just another option that can be available for use. It's another tool that can be used alongside. But yes, it can be affected by beauty treatments. So I think that's all the questions we can be asked. If there's anything else, please let me know. And if you think of anything after, don't hesitate to email the letter that's there, and we'll get back to you. Thank you very much.